Hello, and welcome to another episode of Paramedics for You Too. I'm Zach, and
Stacy. He catches me off guard every time.
it's always different. You never know what's going to happen.
Oh, Lord.
Today we're going to be talking to you about AEMT, which is Advanced EMTs. Like we said before, this is going to be NREMT basis. This isn't going to be state specific, although both of us have been. I've been an EMT basic and an AEMT in Tennessee. Stacy's been both in Tennessee, so we have a little bit more insight that we'll include into the Tennessee way of doing things, but your state, if you are outside of Tennessee, may vary a wee bit, a lot of bit.
Might not have it at all, like
Welcome
Florida.
to EMS. But we're going to be just kind of going a brief overview of what the AEMT is and kind of what their position is on the ambulance or in other areas that they may be working in. So to start off with, we are going to be kind of talking about basically what an AEMT is. Stacy?
So an AEMT, like he said, is an advanced EMT. So you had the basics in the last video. Now we have advanced. The difference is a few little things get added on. We already said that in other videos as well. But they're the ones that you most likely will see with a paramedic on a 911 truck. That's pretty much where you'll find them most of the time. You also can find them in fire. You can find them in hospitals. That's when you start getting enough skills to where you're actually doing more healthcare stuff.
And actually, to add on to that a little bit, if you don't mind, you actually will see double AEMT trucks. This is where you are going to start seeing what the licensure levels are going to consider skilled care providers, as people that can actually work on an ambulance by themselves. So a double AEMT truck will show up to your residence. They will assess you, and if it is within their scope of practice, the things that they are allowed to do, they will transport you to the hospital. And if not, they will call for what's called a paramedic fly car. They will radio in for a paramedic to meet them and continue care from there. And you will kind of see, as we talk about their scope of practice, why that is actually a handy way of doing things with the shortage of paramedics in the country.
What? There's a shortage of paramedics?
I know. Shocker. Don't know why.
Don't know why. Probably because AEMT is the sweet spot.
Yes.
So AEMTs, of course, like everything else, you got to go through the NREMT, complete a course that is already meets or exceeding the NREMT requirements. You have to have that BLS CPR card for healthcare providers. You're noticing we're repeating ourselves quite a bit. And the completion of the cognitive written exam and the psychomotor or physical skills exam. Everybody calls it something different. Again, I'm trying to break down the Hebrew for the layperson. So you do all that, you pass your tests, and you send off your fee, and boom, you're an NREMT, or excuse me, you're an AEMT, and this is what you can do.
AEMT and REMT.
Exactly.
You get both.
It's not confusing. In EMS.
In EMS. So many acronyms, I don't know what to do with myself.
Now you got your license, and what can you do with it? It's about
so you're going to build onto your scope of practice, just like EMR did with EMTB. Anything that EMR and EMTB can do, and AEMT can do. That's also a surprise. I know this video is just full of them. I don't know why. But to add on to that, you also get to administer medications. There are certain drugs that you're allowed to administer. So before, like, you could administer oxygen as an EMR and a EMTB, you can still administer oxygen as an AEMT, but now you have things like aspirin. You can administer aspirin. So if you're on an ambulance, you have aspirin at your disposal, and someone's having chest pain, you can administer your 324 of aspirin, baby aspirin. You can administer nitroglycerin, epinephrine, glucose, Narcan,
D50.
well, D50 glucose. You also get the skills of what's called a supraglottic airway. So your glottis is kind of that area inside your throat that closes off your airway. Your epiglottis is what is. So that area right there, supraglottic airway, means that it goes in above the glottis. It's a blind tube that goes down into your throat, so you're not actually seeing where you're placing it, but it seals off and still allows you to use a BVM that we talked about earlier, those bags that you attach to oxygen and breathe for your patient. And obviously they can't have a gag reflex with that, just like the OPA,
Probably
for
not a good
obvious
idea.
reasons.
Yeah.
but you get the if they're called dual lumen airways or supraglottic airways, you can use those. Um, you can now do IOs, which are intraosseous IVs. So that means that you take a needle and actually insert it into the bone. There are multiple sites. We'll actually go over IOs more in depth in a different video. And you can also, on a more simplistic level, start IVs and administer IV fluids of normal saline and lactated ringers.
Every AEMT's pride.
Yeah,
It's how well they start IVs.
IVs. I mean, once you learn to do IVs, you are, it's kind of a neat skill because you see everybody doing it like on TV shows before you get your license, and you're like, oh, now I can do that. And you also notice, oh, they're doing that wrong.
You'll never be able to watch Grey's Anatomy again.
No, it just doesn't work out for you in your favor at all.
Ruined it.
So next we'll kind of be talking to you about where AEMTs are found in the wild.
Their natural habitat.
Their natural habitat.
The natural habitat of an AEMT, like I said in the beginning, most likely going to find them on a 911 truck. That's just where they want to be. That's if we're going with the animal
it's their
thing.
Natural habitat.
It's their natural watering hole. You also can find them on fire trucks, of course. Most firemen try to keep it at basic. Again, it changes everywhere you go. New York City is going to be totally different from Chattanooga, Tennessee, and Chattanooga, Tennessee is going to be totally different from Podunk, Nowhereville, Alabama.
Chattanooga, Tennessee is going to be different from Nashville, Tennessee. I mean, it's just the
Chattanooga is
way
going to be different from Cleveland, Tennessee. 20 minutes away, for those of you that don't know. But anyways, you're also going to find them in police. Again, so it would advance a police officer's ability to get a job, get raises, things like that. It just make them more marketable.
Yeah, and actually a lot of the firefighters and police officers that I know that do have their EMT license actually have their AEMT license because it makes them more marketable for a part-time job working on an ambulance. Also, ERs like you to have your AEMT because then you can initiate IVs without having to go through that training secondary and all of that. So a lot of people that are going to stop at the EMT level stop at AEMT.
Yeah, it kind of just makes sense in my opinion, but that's an opinion.
And
take it as you want.
That's all this is opinions, basically.
The state's opinion.
The state's opinion, your state's opinion.
The NREMT's opinion of whether you passed or not.
Right, and it's amazing that it's called National Registry for Emergency Medical Technicians, but not all states adhere to NREMT, and some adhere to part of NREMT, and it gets all kinds of muddled. So that's why we always tell you, this is not state-specific. This is going to be basis of NREMT. Please, if you have more questions, either post comments, we'll try to guide you in the right direction, visit nremt.org, or visit your state's EMS board website. That will answer a lot of your questions and kind of give you a better idea of what your state does pre-hospital care-wise, if this is something you're interested in, or just something that you're interested in knowing what type of people are going to be showing up to your house if you have an emergency.
Who are you?
So visit those places. And once again, we appreciate you coming and watching these videos. If you enjoyed it, please like and subscribe, share it with your friends.
Even if you didn't enjoy it, like and subscribe.
Because
you might enjoy the next one.
You might enjoy the next one because we're going to be covering a whole bunch of topics. I know this is all just kind of educational BS, but it's kind of it gives us a basis so that when we start talking about more in-depth skills or certain aspects of EMS, it'll kind of be something that you can come back and rewatch this video and kind of be like, oh, that's why they couldn't do this, but they could do this.
Right.
So, but we appreciate you coming. So until next time, wrong hand.